Hi, my name is Marlana Perry, and this is my personality disorders case study presentation. For this presentation, I chose to look at the Jennifer case study provided by Grand Canyon University. So we will be looking at Jennifer's details, as well as a potential diagnosis for a personality disorder for her with rationale and other differential diagnoses that are potentials. I'll also provide the prevalence and prognosis for this disorder and consider the effective course of treatment for Jennifer. So to begin with, just for some details on Jennifer, she is a successful, highly intelligent woman in her mid-30s. She is recently divorced with the custody of her two sons, and she works in university administration at a local college. But she very much craves the attention of men, and she uses online dating to enter into short, intense relationships with them, often using sexual favors and sexual promiscuity in these relationships in exchange for attention and gifts. And she's recently been in a relationship with a man who she thinks would be a good stepfather for her children, but was unable to remain faithful in that relationship and wants an open marriage instead of the more committed relationship that her fiance wanted. And she hid the fact that she continued to pursue online dating from him, which led to their breakup. Jennifer has reported a lifelong love-hate relationship with men due to a lot of trauma in her relationships with men from a young age. Her father left her family when she was young. She was sexually assaulted in college by a football player, and she feels in competition with her ex-husband to provide stability for her children. And these have all resulted in the patterns of relationship that emerged by early adulthood for Jennifer. And then most recently, she moved across country impulsively, left behind her sons with her ex-husband to pursue a relationship with another man. But she soon returned despondent, and with a lot to say about that man. And she attempted suicide and has been admitted to a psychiatric hospital, which is what has led to this evaluation for her. So, based on her symptoms, borderline personality disorder is the most likely diagnosis based on the DSM criteria. So this is she has to have a pervasive pattern of at least five of the DSM criteria for borderline personality disorder. And here we have six listed that she meets the criteria for. So unstable relationships. These are relationships that just they are fast, quick, intense, and then also lead to devaluation and avoidance when they become too serious. And this is definitely how she engages in relationships. She is quite impulsive. She makes decisions before fully processing, and has a disregard for the consequences of her actions. She features chronic emptiness, which includes feeling the need to constantly fill her time with distraction and attention from others. And this can be seen in her determination to find love no matter what, but then also never being satisfied in a relationship. She definitely fears abandonment, which is a key symptom for individuals with BPD. And it is seen in the erratic ways that she interacts in her relationships. She often detaches before relationships get too serious, and she reacts erratically and with clinginess when she is not the one to detach. Suicidal behavior is also a symptom of BPD, and 10% of individuals with BPD die by suicide, and up to 80% attempt suicide at some point in their life, which Jennifer recently has. And then also an affective instability. So this includes rapidly shifting emotions, reacting more strongly to situations than warranted, depressive episodes, and suicide attempts, all of which Jennifer has. So she definitely meets the criteria for borderline personality disorder by meeting more than five of those symptoms criteria. So there are differential diagnoses to be considered, which includes other personality disorders as well as other mental health disorders. Um, Histrionic personality disorder and narcissistic personality disorder do share features of attention seeking with BPD, but they lack the fear of abandonment and the chronic instability that Jennifer features, which means that her symptoms are more related to BPD than these other personality disorders. ADHD and bipolar should be considered due to her erratic behavior and rapid mood changes, but these symptoms appear to be persistent and integral to her personality and self-identity. So other mental health disorder diagnoses may be secondary, but a personality disorder seems a more accurate primary diagnosis for her. So borderline personality does exist in the cluster B of personality disorders. So these are disorders that are dramatic, emotional and erratic. These individuals struggle with impulse control, emotional dysregulation, and unstable relationships. So these are all things that have been pointed out as something that Jennifer struggles with as well. So, in terms of the prevalence of borderline personality disorder, it is more prevalent than many other personality disorders, with up to 2% of the general population qualifying for a BPD diagnosis, but is definitely highly representative in the psychiatric cases. So 12% of outpatient mental health visits are from individuals with BPD, and 22% of psychiatric inpatient cases are um, individuals with borderline personality disorder as well. It is often more it is also more often diagnosed in females than males. Up to 75% of cases of BPD are assigned diagnoses to females. So it is definitely a more female heavy diagnostic. So the prognosis is actually better than expected. So the onset is during adolescence and early adulthood. And it is unclear whether genetics or environmental factors play more of a role in it. There's a high interaction between the two. So both influence this disorder greatly. It was previously thought to be untreatable, but this has been dispelled. And so remission is actually quite common with evidence-based treatments, which will be discussed on the next slide. But this gives a lot of hope that, a lot of individuals with BPD no longer meet the criteria for BPD after several years in treatment. So that's great news for individuals like Jennifer. So the best course of treatment for Jennifer involves a few steps. So first, a risk assessment and safety plan need to be developed. This is definitely a necessary first step to ensure safety and should be completed while Jennifer is still in inpatient care. A safety plan in particular is very important since individuals with BPD often attempt suicide multiple times. And so having a plan in place so that she has coping skills and knows the next steps to take if she feels the urge to self-harm is crucial. And then long-term dialectic behavioral therapy is considered the standard therapeutic model for individuals with BPD. It's actually a branch of cognitive behavioral therapy, but was developed specifically to treat borderline personality disorders. And so it focuses on teaching clients behavioral skills targeting their specific symptoms, including the fear of abandonment, unstable relationships, and impulsivity. So using DBT has shown great success in causing remission and helping individuals find healing and healthier relationships following a borderline personality disorder diagnosis. And then also a integrative care coordination should also be considered, and partnership with a primary care health team would be great. There's no medication to treat borderline personality disorder, but to treat co-occurring depression, anxiety, and Jennifer's feelings of worthlessness, medication may be warranted, and this can support her care in other ways so that she has more of an ability to engage in the other treatment aspects if she's not constantly fighting against those other symptoms without some medication and care in that regard. So these are the main pieces of the treatment that I think would show a lot of success in Jennifer's case. And it's important to remember that with personality disorders, it's often from trauma and neglect in childhood. And so these clients can be very difficult to work with. They are often volatile, dramatic, and unstable, but they're really just looking for a place to be understood and to feel safe doing so. And a lot of their volatility just comes out of a way of trying to cope and protect themselves. And they've developed maladaptive ways of doing this. And so a clinician providing a safe environment for a client to be understood and to pursue healing is crucial. And in a situation like that, though, clients like Jennifer can absolutely find better ways of being in the world and growth and healing and be able to move forward more adaptively so that they can form better relationships and feel really successful. So thank you for being here for my presentation. And I have a lot of hope that in cases like Jennifer, a lot of progress can be made. Thanks again.